Hi, Mindy Stovall. This is my patient, Angela Cooper. Angela is a 24-year-old female. She is currently 28 weeks pregnant, and she has came to the clinic today for a routine follow-up and to receive her RhoGAM injection. I will be providing education to Angela about the RhoGAM injection. Hi, Angela. How are you today?
I'm good. How are you?
Fine. So my name's Mindy, and I think we've probably met before. There's several of us here, but so I've looked through your chart, and it looks like you are 28 weeks pregnant. How are things going?
Great.
Good. So as you know, Dr. Smith came in, and it sounds like he did his check on you and everything looks really good. But he's asked me to come in and give you the RhoGAM injection. I know he, told you you'd be receiving it, but did he give you any details about it, or do you have any questions?
Yeah, he just told me I would need it, but he didn't really want to detail why I would need it. So.
Okay, perfect. Well, I'll explain a little bit to you, and if at any point during the explanation, if you have any questions or then just let me know.
Okay.
So you, by the looks of your chart, and correct me if I'm wrong, you are A negative.
Right.
Is that correct?
That's
okay.
correct.
Dad's A positive.
Mm-hmm.
So there is a chance that baby could be born with A positive blood. So there's a negative and positive there. And what determines that negative and positive on our blood type is called a D antigen. Whenever a mother has a negative blood type and that child has the potential of having that D antigen, which is that positive blood type, then there's a chance that there could be complications there if the RhoGAM injection was not given. There is a couple of websites that I've written down here for you that you can reference.
Okay.
We do follow best practice here, which means that we give the best care. We follow standard of care, the guidelines that are set forth by several different national agencies.
Okay.
A couple of those that I've written down for you are the American Association of Blood Banks and the American College of Gynecologists and Obstetricians. There's some information on there. A lot of it I just went over with the D antigen and kind of the explanation of why you need it. I noticed Dad's not here with you today, so
right, this will work great for him.
Yeah, you guys can sit down tonight and go over that. And if you have any questions after you get home or whatever, if he doesn't understand, feel free to give me a call and I can explain it to him also.
Okay.
Now, did Dr. Smith go over any of the risk of not receiving the injection?
No. What are the risks if I don't take it?
So, not receiving the RhoGAM shot could put you and baby at risk for a lot of complications. What happens is if you don't get the RhoGAM injection, then your body could reject the baby. If baby has positive blood type, your body could reject the baby as if you had a bacteria or a virus.
Okay, so it's basically attacking the baby.
Correct.
Okay.
It could attack the baby. It would build up that antibody against the baby, and it would fight the baby just like a virus or a bacteria. Okay. So it is very important that you receive it. You will also receive it again within 72 hours after delivery if your baby girl comes out and has a positive. Or, and it's not just A positive, it's any type of that positive blood type.
Okay.
So in your case, baby has a chance of being A positive. So if she would come out with that A positive, you will receive it again. Now, if she gets your blood type and she comes out with A negative, you don't have to. But
okay. So is this, so if I take this injection, or is the risk gone? It'll be safe after that?
Sure. At 28 weeks is a recommended time that a mother receive the injection, and then again after delivery. If you did plan on having any testing that are done in between your 28 weeks and delivery, where it would be invasive or anything that would put you at risk for your blood and baby's blood to intermix, then they would give you another one.
Okay.
But you've had a really good pregnancy. I don't foresee that happening. So I would think that you will get it today, and then I foresee that you will be fine, and then just receive it after you deliver if needed.
Okay.
Okay? So take that home to Dad and let him kind of look over that if he would like to, and then we'll go from there.
Okay,
Did
sounds
you
good.
have any other questions for me
No.
about the blood type of the baby or anything
I
like
don't think
that?
so. I think you explained everything very well.
Okay, all right. Well, I'll probably see you again at your delivery, and who knows, I might be the one giving you your next injection of Rogam.
All right.
All right, thank you.
Thank you.
Uh-huh. Hi, Angela.
Hi.
Hi, how are things going?
Great.
Looks like you had a healthy baby girl.
I did. She's beautiful.
I saw her in the nursery earlier. She is such a cutie.
Thank you.
I did check the chart, and it does look like she does have a positive blood type.
Okay, so how did they check that? Did they draw her blood or?
So how they get the blood type of the baby is by doing a cord blood sample through her umbilical cord.
Oh, okay.
Yep, through that cord. They take the blood out of there, and that's how they get the blood type of the baby.
Okay.
So she wasn't, stuck with a needle and stuff to get that. They do other, pricks of the heel and things like that for other tests. But in this case, they usually do a cord sample of blood,
Okay.
and they test her, and it looks like it was A positive. So if you remember right, in the clinic when you were 28 weeks,
Mm-hmm.
we talked about you getting this Rogam shot again if your baby had a positive blood type.
Correct.
So it looks like we do need to go ahead and get that injection.
Okay.
Now, do you have any other questions?
I guess I would wonder, what about future pregnancies? Is it safe for me to get pregnant again? What do I need to be thinking about?
Sure, I totally understand. So as long as you get the Rogam injection after your delivery, if you get it at 28 weeks and then after your deliveries, you can have as many kids as you like. Now, I will tell you that if the baby is born with a negative blood type, there will be no need for you to get the injection after you deliver. However, it is still very important that you get that injection at 28 weeks,
Okay.
no matter what blood type was.
Okay.
So 28 weeks and then not again if the baby is negative at birth, and 28 weeks and yes again after birth if the baby's positive.
Okay.
But as many children as you would like to have is fine.
Okay, great.
Okay, so did you talk to your husband about the Rogam? Was those websites that I provided
Yes, those
for you?
websites were
those
great.
were
He
good?
was very grateful for those.
Good,
so,
good.
Yes.
Okay, do you have any other questions before I get that ready?
No, I don't.
Okay, well, thank you. And again, you've had a very beautiful baby girl.
All right.
Congratulations.
Thank you.
Uh-huh.